Hi everybody, I wanted to do a video, just a brief video on frequent questions and answers that I've gotten in regards to pregnancy after gastric bypass surgery. To recap quickly, I've had gastric bypass surgery almost 3 years ago. July will be 3 years, and I got pregnant 13 months after my surgery. One of the questions I have is, how long do you have to wait? So my surgeon recommended that we wait 12 to 18 months after surgery for a couple of reasons. One, to make sure that you reach your goal weight, and probably the most important reason is to make sure that your body can absorb enough nutrition for you and the developing fetus. So that was one question. Question number two was, did I have any complications due to gastric bypass? And thankfully for me, the answer is no, I didn't. Corey developed well. I was able to take in enough to eat, so no issues there. Another question I get often is, did I take the glucose test? I forget what it's called. I think, anyways, no, I didn't take it. I've heard from other gastric bypass patients that who've gotten pregnant that their doctors, for lack of a better term, made them take it, and they had adverse reactions. So luckily, my doctor is not a stickler for gotta do it this way, this way, this way. I was a participant in my care, so when I told him that I couldn't do the sugar, he said, okay, we'll just do a fasting blood work, which would give you basically the same issues. But keep in mind that I didn't have any problems with diabetes or pre-diabetic before my surgery, so I imagine if you were in that category, that the test that your doctor decides to do may dictate, may change according to what your risk factors are. So I just didn't eat anything that morning, and went in and they did a panel of blood work, and it came back that my blood sugars were actually low, but I didn't have to do anything different during the pregnancy because of that. The only thing that I did, and it wasn't because the doctor told me to or anything, was I just ate like every 2.5 hours. That was because I had to. I would start getting kind of lightheaded, nauseated, kind of shaky if I didn't do it. That was one of the things that tipped me off to the fact that I might be pregnant, is I almost fainted at the college bookstore in line one day, and I thought, that's kind of odd. Another question that I get often is, was my delivery affected because of gastric bypass? And it wasn't. I had a cesarean section because Corey Jack was breech. It had absolutely nothing to do with gastric bypass, though. What are you doing, buddy? Let me think. I know there are other questions that I've gotten. I didn't have to follow any special kind of diet. I didn't have to go to the doctors really any more than anyone else would. The doctor thought that we would have to, because of the whole slow absorption thing, but luckily I didn't have to. I didn't have any problems with protein in the urine or nothing, just no problems at all, thankfully. Let me think. God, there's more questions, and I know. Oh, my weight. Did I gain enough? Did I gain too much or whatever? I don't mind telling you all my weight. My goal was 180, and I was below goal when I got pregnant. In the beginning, while I was pregnant, I think I got down to like 162-ish, and that was because I was nauseated in the first trimester, and I got up to 203, and went back down really quick after delivery. I breastfed, which helped lose the weight. So that was all groovy. And another question was breastfeeding. Did I have any problems breastfeeding because I had gastric bypass? And I didn't. Corey Jack will be 14 months, and I still nurse him at night at bedtime. We're slowly weaning him off of that. I've really let him direct how the weaning is going, but that's a whole nother video. Let me see. I think that's it. People have asked, has my PCOS improved since I had gastric bypass surgery? And really, I don't know. I got pregnant without trying, thankfully, which was a welcome relief after 12 plus years of trying to have a baby. But I was on birth control pills until my year anniversary, so that helped regulate my cycle. I didn't have to worry about that, which is a symptom of PCOS. Sometimes your cycles are off. And then I got pregnant, so then obviously I didn't have a cycle all that time. And then I didn't have another period until I think Corey was 11 months. And ever since then, I've had a cycle, and they've been fairly regular. Came on the 23rd, 1 month, the 26th, 1 month, and then I was late the 3rd month, which I thought I was pregnant again. It came on the 3rd, so again, he's still breastfeeding, so I imagine that has something to do with it. So, you know, my body's trying to find out what's going on. My other symptoms of PCOS is the hair falling out, the facial hair, a hard or long period, skin tags, I think, are a symptom of PCOS, and all that has improved. I still lose a little bit of hair, and I think that is because of the PCOS in conjunction with being gastric bypass, but nothing really to speak of. That evened out for me when Corey was about 6 months. You know, so there's a couple of reasons there. Postpartum, you lose hair, and then gastric bypass surgery, you lose hair. But it kind of evened out when he was like 6 months. And I think those are the basic questions that everybody asks. When did I start to show? I think I started to think I showed around 17, 15 weeks, somewhere around in there, because I have the extra skin. But for a long time I had that line across my belly that most of us big girls have, where our pants sit for the most part. And then, no sir. And then I didn't have it, and I can't pinpoint which week it was in my pregnancy. All my videos are there if you want to go through them and see when that went away. But no sir. Eventually I did stop looking fat and just looked pregnant. So I think those are all the questions. I hope I answered them thoroughly enough but concise enough. If you do have any questions, please let me know. I try my best to send personal responses back to everybody, either via video or email message. But we are blessed. 13 months, I'm sorry, almost 14 months after, he's starting to walk, and he's in perfect health. He didn't have any problems developmentally or anything. 3 years later, I just had my 3-year checkup. My blood work is all great. My B12 is a little high, which is good. Most people have low B12, and everything else is groovy. So I hope you all are doing well. And for those of you that are considering getting pregnant after gastric bypass, please try to follow your surgeon's guidelines on when you should do that. It just makes it better for everyone involved. And try as best as you can to relax, but don't let the pregnancy be an excuse to just eat whatever you want, because afterwards you can't do that. So that's it. I'll talk to y'all later. Bye bye.